So, good morning and welcome to another edition of our Public Enlightenment series on Solid 100.9 FM and in partnership with TESH, the Eye Specialist Hospital. Today, we continue our glaucoma awareness campaign with an important conversation on a topic that concerns everyone, not just those already living with glaucoma. I had a conversation with a young lady. If I remember correctly, she's just about 25, but she is visually impaired. She can't see. And each time I think of her, I imagine the level of limitation that she's going through is hard for people who can move around by themselves. Imagine someone who at this age, 25, will have to find a way to live all by herself. So many people believe that once glaucoma is diagnosed, only medication or surgery matters. But is that really the complete picture? Can the way we eat, the way we sleep, the way we exercise, manage stress, and live every day influence the progression of glaucoma? Are there habits that can protect our vision and others that unknowingly make things worse? These are the questions we'll be exploring today as we discuss healthy living, lifestyle's role in managing glaucoma. And of course, joining us is an experienced ophthalmologist, Dr. Obinna Shiwobi, who will be helping us understand the lifestyle choices that can support eye health and improve the quality of life of people living with glaucoma. Dr. Obinna, good morning to have you.
Yeah, Uncle Yusi, good morning. The buying Dalon Ona Bochi Ona Bapela.
Anya Bapele. If it's my people will say Anya Bapele. All right, so like we always do, because one thing about the radio is that there are always first timers. There are those who are joining for the very first time. And so what exactly is glaucoma, and why do professionals like you refer to it as the silent thief of sight?
Yeah, Uncle, thank you so much. Let me apologize the cause for the delay. My apologies, please, everyone. Once again, we want to thank Solid FM for this privilege, this social responsibility to our people. And I want to say, Uncle Chris is bearing fruits. People come to the clinic now, being aware that they should have their eyes checked. Yes, I'm telling you the truth. People are coming, and then it makes sense because that is actually what we want to achieve. Because you want to stop preventable blindness. You know, like we said earlier, 75% of blindness in sub-Saharan Africa are preventable. I mean, these are well documented evidence, you know, and we plead with our people to do the needful. Glaucoma, like we've said earlier, is a disease that affects the vision, affects eyesight. It affects the optic nerve, the nerve of vision. And we know, documented evidence that it is it is not reversible. It is not curable, but it is treatable. Like we said earlier, for those who are diagnosed of glaucoma, it is not a blindness sentence. No. It means that you should do the needful. And more so for those who come for checkup. What it means that if you are caught on time, if you are seen on time, and then the diagnosis is made that you have glaucoma, it means that your vision will be protected all your life. Because what is annoying is that people now come to us when they're already visually impaired or blind, expecting us to revert it. No. Scientifically speaking, it is irreversible. And then it is the truth. And we plead with our people that the wisest thing everyone should do is to ensure that annually, once a year, you have a checkup. We say general checkup, but we also say, for the purpose of this program, an eye checkup. The essence of it is that you are given a clean bill, that you are perfectly okay, you are doing well, you go home happy. You will come back again next year, and have your eyes checked. You lose nothing doing the needful. Our people say something must kill a man, but it is foolish If that thing that killed a man, would have been prevented, or is preventable. So I mean, it is a man who dies of a preventable disease actually died of folly because he did not do the needful. So it is what we are trying to tell our people. The disease is here with us, and like we said multiple times, the disease is commonest among the blacks, the Negroids, worldwide. And in Africa, commonest in West Africa. And in the Nigerian study, commonest among the Igbos, which we found to come from our gene. It is not from what we eat or our environment, no, but it is genetic. So also you also have, almost every tribe has a disease that they are known for. The Jews too, the Caucasians too, and so it is like that. Nobody will say, God, why us? No. The same God that allowed it has also allowed treatment, has allowed solutions for it. It is only appropriate that you take the solutions and then don't become blind or visually impaired out of negligence. This is what we are trying to say. That people should do the needful, and it does not cost much. Let me even say that twice in a year, almost all the teaching hospitals and some very prominent big hospitals like Tesh offer free eye checkup at least twice a year. That allows the people to have their eyes checked. So this is what we're trying to say, that person who hears what we've said, like I know the scriptures will say, let he who has ear hear. Thank you so much, my brother.
All right, I'm impressed that people are turning up, and in case you're listening and you've not had, I know there are people who in all of their 30 years of existence, 50 years of existence, have never gone for an eye check, which is dangerous. When I was in the hospital, there was this thought that came to my head: it doesn't look like it will happen until it happens. And that's the truth. The people who go blind never signed for it. They never discussed with anybody that, okay, when I turn 50, I will lose my sight. But it happens. So whatever you can do to help yourself, you just have to do it. And time is of the essence. That's to say, you don't do it whenever you want to, because you could actually start going when it's almost gone.
Yes.
So while you were talking, you talked about treatable and curable. I need you to do a bit of clarification.
Okay.
You said it's not curable, but it is treatable.
Okay. You see, when we say curable, it means that this disease, once given medication, the medication ends it. Now, let me give you an example of malaria. So, when somebody comes down with malaria, proven that this person has malaria, and is giving antimalarials, we don't give chloroquine anymore, but Coartem, Artemether, Sulfadozine, Fancida, and we can even give the injections, the email. And most times this run a course of 3 days. Though a patient may still have malaria for some maybe 2 or 3 days, it is cured. Now, if that patient does not come in contact with mosquitoes, the patient will no longer have malaria. Now, so it is cured. Same also with typhoid fever. For those, not the gossip people now say every time I have typhoid malaria. It's not like typhoid fever is not that common. But our people tend to go with the trend. Like you want to make a sickness look big. Say it's typhoid malaria. So that is also treatable. If you do the needful, use the proper antibiotics tailored against the organisms that cause typhoid fever, the patient is healed, is cured of it. Now, for diseases, what was call them chronic diseases like diabetes, hypertension, and also glaucoma, hypertension is not cured. It's not curable in the sense that, but it's treatable. You give patient drug all his or her life to keep the pressure under normal range, so that the patient is protected from consequences and complications of hypertension. Likewise, consequences and complications of diabetes. same also with glaucoma. You give drugs. Most times what is amenable is intraocular pressure, so drugs are given to bring the pressure to normal between 10 to 21 millimeters of mercury. That is in about 90% of patients. About 10% of patients do not fall into this range. Some may be higher, but still it is within normal limit. Some may be low, what we call normal tension glaucoma, but in essence it is high for the optic nerve. So this is the main difference between curable and treatable. Treatable means that this disease is chronic, cannot be cured, but can be treated. Now curable means that this disease, once treated, ends. But the other one does not end. You treat it, you keep maintaining it all your life so that it doesn't go. There's nothing you would give a patient and then diabetes is gone. And I want people to realize that this is the truth. That people who run to concussions and other things, saying when you take this, and then it is very annoying when people who are intelligent, who should know, come under such, I don't know whether it's a spell, and say that when I take this how about this, and then that is it. No, it is not curable. I mean, this has been proven over and over again. So we know this is the truth. So this is actually the major difference between a disease is curable and a disease is treatable. So for glaucoma, it is treatable and not curable.
Okay, I would like to know why in particular you chose to focus today's discussion on lifestyle and healthy living.
Okay. Thank you, Uncle Isi. We've discussed treatment options for glaucoma, which includes eye drops, tablets, and in some cases injections, and then in some cases infusions as drips. And then we also talked about the second part, which is the laser, which is also a treatment option for newly diagnosed patients and patients who can afford it, and then those who do not want to undergo surgeries. We also have surgeries for glaucoma. And now I keep people asking this question, that somebody said there is no surgery for glaucoma, and that is a pure lie. And I ask people, Google it, go to the textbooks. Don't listen to, when you want to listen, when you want facts, ask the medical doctor. Don't say they will say it in our yard, and we said it in our in our workspace, and I went to work my car at the mechanic, and somebody said it is not don't do surgery for. No, such things are not meant for. You don't get such facts in such market discussions. Such information should come from professionals. So the essence of these lifestyle changes they are adjuncts to management of glaucoma, things that also help the lifestyle, that can also help improve this patient. Now, if the patient takes these or drugs and does not have a balanced diet, does not do exercise, does not have enough rest, this can also count against this patient, and then may also cause more progression. Now, like we said, the most important thing is patients must be on treatment, and then these lifestyle changes that can one way or the other help these patients overcome the complications and the consequences of the disease. So that's the sense of this whole discussion, because it is so imperative that people should know what are those things that can help. Now, these lifestyle changes are not on their own treatment options, no, but they help. The adjuncts, like how people want to eat abacha, they add a vegetable, they add onions, they add tomatoes. Now these are adjuncts to the main meal, tend to be make it like a balanced meal. They also add some proteins, either the skin of the goat, the kanda, or fish or meat, just to make the abacha. But the most important is the abacha. That's the main meal. But these adjuncts also help provide a balanced diet, so that when you eat it, you are happy you've eaten a proper diet. So That's what we said here. So okay, let's start with physical activity. We've talked about moderate aerobic exercise, like brisk walking, jogging, or cycling for at least 30 minutes 3 to 5 times a week. This can improve blood flow, and this blood flow also help lower the eye pressure, and therefore they are adjuncts to helping you control your intraocular pressure, which is the only thing amenable, the only risk factor that can be treated, in all the risk factors that can lead to glaucoma. The other one is avoid inverted positions, exercises or yoga that poses, that putting your head downwards, under a prolonged period. We say no to such.
Is there a reason for that?
Yes, because they can easily increase. You can imagine when the eye is embedded in the eyeballs. The head from the landlord. The base for the. So when you turn your head down, you also increase the blood flow. Also increase, the intraocular pressure. The eye tends to bear the pressure, unlike when it is up. So we talked about exercises that would make the body come above the head. No, this we do. I think last time we also discussed it. So this is why head stands, shoulder stands, or downward facing can significantly increase the IOP. The other one is weightlifting caution. For that will be, when lifting weights, we breathe normally, holding your breath. That is what called Vasova maneuver, or lifting heavy loads while straining can temporarily increase your eye pressure. When you are doing that, everything tends to stand still. You do understand? Because you're not even breathing well. You're holding your breath. You're trying to be able to carry this heavy load. Then we talked about the tight neck wear or eyewears, ties, collars, or constrictive clothing around the neck that can restrict blood outflow, and then increase intraocular pressure. So we talked about this. What we mentioned are all exercise and physical activities and postures that can help reduce intraocular pressures. Then we talk about diet and nutrition. This we've discussed earlier too, and we talked about foods that are very rich in antioxidants. Now let me just say that the foods common to us, they will say colored foods, the green fruits, the yellow fruits, the red fruits. Well, sorry for those who love mangoes. Mangoes have gone, but these are highly expected. They are very rich in antioxidants. So we plead with our people to ensure that fruits form part of their daily meal. The issue of seeing them and eyeing them, smiling at them and passing, you shouldn't threaten to buy them because they are for sale and they are for consumption. I understand the socioeconomic downturn of things in Nigeria, that people want to eat first before they talk about fruits.
It's the first time we never chop the
So we agree on at least this era now. This period is that period of very leafy green vegetables. There are plenty now. They could form part of your yam, part of your rice, part of ensure that even your soup is filled with vegetables, not sparsely, more of a fluid than vegetable. No. Soups should be filled with vegetables, and this
there are those who just don't like it. There are those who don't like it.
No, it should be. They provide vitamins A and C, and this help convert oxidative stress of the optic nerve. These are antioxidants. They are oxidants that very terrible chemicals that actually affect the eyes. So these tend to curb them. The vitamin C and A. Now we'll talk about omega-3 fatty acids. Most of the time, people come up with multivites, supplements, and for us as ophthalmologists, we tend to look at what they contain. There are things we look out for. Once we don't see those things, that is not for the eye. It's not for the vision, because these are basic things that they should contain. One of them is this omega-3 fatty acids. There are more, the zeaxanthin, the lutein that we also look at, and other forms of zeaxanthins too, So they all help in protecting the eye and the nerve. Then we'll talk about caffeine, but we will say moderate, because high caffeine intake, more than 2 cups a day, can temporarily increase eye pressure. You know what? We talked about this. I know our area is not the very cold area, like people in the Scandinavia, in Russia, where people tend to take things that make them hot, Well, I think our area is okay. We agree that people should be careful with the way they take coffees. Now, the herbal supports. Now, we've known that some supplements help, just for people to know that we are not against herbal medicine, but we want to be sure of its constituents, what it contains, what it does, and how it affects the body. As per what are the side effects. We don't just think things without knowing the side effects. So it's only important that we should take what is important. There's this supplement we give, we call it ginkgo biloba. This has been, it increases and improves blood flow, and then we've known that even in memory, people with memory loss or dementia, it also helps them regain some of their memory. Now, having said this, we talked about the third one is the sleep and environment. We talked about elevating the head above the bed about 20 degrees, and this can reduce overnight eye pressure fluctuations. Then people who have sleep apnea, these people who have obstruction of sleep, breathing over the night, is what we call obstructive sleep apnea. We say it should be treated. A physician should help treat it because they are linked to glaucoma progression. Then, what some people will not want to hear, we say quit smoking, because we've known that it increases blood pressure and then can also cause systemic inflammation, and this all negatively impact on the eye health. Now, stress and mental well-being. Uncle Isi, how do you talk about stress in Nigeria? Where people tend to work long hours to see if they can make ends meet.
The ends never
Will the ends ever?
Okay, I'm curious about, just before you continue with the stress, I'm curious about the obstructive sleep apnea.
Yes.
This morning around 6 a.m., I told him that for a lot of people, waking up is a miracle.
Yes.
So I want to know, how expensive is the treatment of that apnea, since it's a contributory factor to
Okay. Yes. What thing about the
people don't even know what it is, because most people, when somebody dies from the sleep, they just think village people have done what they do. But
yes,
I think I've gone through it. I know what it feels like. For 30 seconds, your breath could just cease. And then if you come back, it's a miracle. If you don't come back, it means that some people have sent some jazz. but it's much more than that.
Okay, so the obstructive sleep apnea is a common disorder where the throat muscles relax and repeatedly block your airway during sleep. And then you see somebody momentally starts breathing, and then these people actually snore, especially. And one thing about them, many of them are obese. And then people who eat late at night should be very careful. At night the body wants to relax. To keep the body too active, trying to process the food you ate by 12 midnight or 11, it doesn't sound good, And then we talked about, say at night time you see them, many people are not aware. It is your partner, your wife, or your husband that will tell you what happens over the night, And you see them loud sleep, very disruptive snoring, and they tend to gasp. At the time, they will just I said, I hope this person has not stopped breathing. Then they will not breathe down again. Breathe as if they're breathing well. Then before you know it again, they will hang. The breath hangs. then you see they have this issue over the night. Then in the morning, you see that many of them become drowsy and easily fatigued. Then morning headaches, and then what are the risk factor? I mentioned obesity, and the excessive fatty tissue around the neck. Then anatomy, as per the body makeup, they say fully come. Those who have natural airways and enlarged tonsils. This enlarged tonsils is common in children, or a recessed jaw, a jaw that tends to go behind. So these people are more likely. Then we talked about age is higher in men, and then also in postmenopausal women. This postmenopausal women, if they're also obese, is also a big problem. And it's also the way people sleep, tend to sleep lying flat, and then smoking, alcohol consumption, and then those who use sedatives to sleep at night, also run these things. So what do we do? The treatment options could be, ideally, how do you keep your airway open? So pulmonologists, that is respiratory physicians, will be of great help here. What we call oral appliance, what they call custom fitted mouthpiece that thrusts your jaw forward to keep your throat clear. And then what they call a positive airway pressure. There are also these lifestyle adjustments. We talk about weight loss, avoiding alcohol before bed, and then positional therapy, learning to sleep on your side rather than on your back. People say more on the left side, the heart being down than being up, and then avoid lying on your back facing up. So the sides make you tend better. And when they do this, ask them to sleep by their side. Call them by name. Please, can you lie by your side? You find that the breathing tends to get better. And then
sleeping by the side is
sleep by the sides.
Okay.
Yes, healthier. Sleeping by the sides.
Left or right side.
And left or right side, but left is better because that keeps the heart down. So the obstructive sleep apnea is really an issue, and in some cases people's sleep can actually be cut off. And we ask our people, they say everything has advantage, but I've not seen where obesity. I don't see, except those who do that wrestling done by Japanese again. Sumo wrestling. Maybe that's what the advantage should be. But when they say everything has advantage, has disadvantage, I just don't know about obesity.
Okay. Let's get some calls. Get in your questions as quickly as I can. We have less than 15 minutes to go. 0909 771 1009. You can join us. Okay, I already have a question. Hello.
Hello. Good morning. It's Angela from Innocent.
Yeah, you're welcome. Go ahead.
Please, I just want to ask a question.
You just want to do what?
I just want to ask a question to God.
Yeah, that's what we're doing now. Go ahead.
Okay. It's just about I'm blind now, but I have tried everything just for me to move on, but I can't just move on because even school, I don't know what to do anymore. I am tired of doing anything because there's nothing that is nothing that I can do now. Everything.
You don't
everything I do now.
You don't have a family that can help you?
I have a family, but my family is not helping. Everything is in my head.
Why are they not helping?
I don't know. Everybody is doing their own thing in their own way. That's the kind of the family I have.
Okay.
So it's good for us to know her age and then.
What's your age?
Okay, I'm 28 years.
28, very young lady.
So we can get her to learn a trade, learn to utilize her hands, and then do things, learn to use the braille in case she wants to go back to school.
At the point she wanted to go back to the school of a blind. She wanted to, at least so that she can navigate and move around.
And be independent. And look for, I think, we decided to do it. Look at her number.
Okay. Another place you could also try is Bina Foundation. Yes. Bina Foundation is somewhere around Tinker's Corner. And yeah, can you hear us?
Yeah, Bina Foundation is no more. They have closed sometimes.
Okay.
They have shut it down sometimes now. It's 2022.
I'm the one that is not updated. Okay, we'll find a way. Another thing that we could do is, of course, anybody who is listening can help. It's not something that one person can shoulder because it runs into hundreds of thousands. To send her to Oji River School of the Blind will take nothing less than 300K.
It's doable. Like you said, we have people listening to us. Maybe one or two people may call you after this. But I want to just tell the young lady, have hope. Don't give up. I trust God that hope is on the way. We'll try and get a number so we can interact more and get you to a place where you could be useful to yourself, help yourself, and be happy.
And this is what government should be doing too, help people. Okay, so what we want to do is let's try to help this lady. Let's try to help Angela. And if you want to help, you can reach me. Reach me on 0813 314 2282. 0813 314 2282. Just reach me. She can see at 28. Kedeba na ebido kedeba. I mean, ije talaka. 28. I mean, and this kind of situation has a way of affecting their psyche, their self-worth, and a whole lot of other things. And then you can move around, try and come to Solid FM, because there's also been situations where you start raising money and people are like, have you confirmed that this person really cannot see? So we need to confirm that. Hello, good morning. Hello. Are you asleep? Okay, 0909-771-1009. If you want to ask a question, you have to be fast because we just have like 2 minutes remaining. 0909-771-1009. Okay, Doc, maybe you just let's get this call and you start winding down. Hello?
Well, good morning.
Yeah, good morning.
Yeah, my name is Joy.
Okay.
I'm calling from Egon State.
You're welcome, Joy.
Yeah, thank you. I didn't start the program on time because I didn't get. But there's a question I want to ask the resource person.
Yeah,
please,
go ahead.
I do have current relapse of this strong headache in my eye. So I don't know. Apart from medications, right? Sometimes I do try to stay. I don't even know that it works. Like the left side of my hands, don't lie like that, so that the pain will relieve. But if I take drugs, it does not relieve. So I don't know. Is there any other remedy that I can be using? Because the last time I was told to go for laser treatment, but that's not something I can go for now.
Okay.
So that's my question.
You not told me what you have.
She's visually impaired as well.
Yeah, but she said she also has pain in the eyes. Visually requires, we need to evaluate you.
I think it's glaucoma too.
Okay.
Yeah.
It's glaucoma too?
Yeah.
Okay.
Close angle glaucoma.
Yes, so we need to evaluate you, and very importantly, we also need to see every member of your family as per your siblings. We should also start now to evaluate them before they get visually impaired. Now, we want to know, are you mildly, moderately, or severely visually impaired? That will determine what treatment.
I can't see at all.
Come again?
I can't see at all.
It's okay. So what?
But you can see, right?
Yeah.
Okay, I'll be in touch on Monday, 9 to 5.
She's not in Enugu.
He's not in Enugu.
Mm.
Yes, sir.
So where are you?
She's in Ebonyi
I'm in
State.
Ebonyi.
Okay, can you come to the teaching hospital on Thursday? Come to the eye clinic.
In Enugu.
No. The Alice Equipment Federal Teaching Hospital. That's the special
On Thursday.
on Thursday.
Ah.
Yes. The Glaucoma clinic runs on Thursdays.
You say you normally what?
The Glaucoma clinic runs on Thursdays.
Okay.
So can you come?
Let me see.
Just come. So we know
Sir?
whether we are going to offer you low visual aids or we just know how to help you. You know, we can't say things from afar until we see
You need to be examined.
You know. So when you come, ask for Dr. Bina, she will be. Or just say Dr. Bina. They will bring to where I am. We will see there, and then we'll take it from there.
Okay, let's get a wrap up. What time is up? Doc.
Okay. The Alopana. We want to just say that a stitch in time, I will always say, saves 99 and not just 9. You know, beautifully enough, wonderfully enough, though we're not happy with the situation, 2 young people called us. You know, one is totally blind and the other is visually impaired from glaucoma. It makes it very imperative. It brings to the fore. It makes what we're saying, you know, real. That we're not just here talking about stories or gossips or things that don't, that don't make meaning to our people. These are real. You know, there are people who have glaucoma now, they don't know. You will not know because the symptoms come late. And by the time they present, you are already almost that visually impaired or almost going to blindness. And that's why we say such a disease. The question the uncle asked me was, why is it called the thief of sight? Because it is stealing your sight without you knowing. You know, if you know something is stealing your sight, you will do the needful.
But for now, it is a thief because it keeps taking your sight daily. And because you are nonchalant, because you don't believe in what is being said, because you believe that something must kill a man, what will be will be.
Right.
You know, and then you don't do the needful. I think it's only appropriate that when you begin to have such issues like you are visually impaired, or you close one eye, you are not seeing well with the other eye, or you try to read prints, you can't see prints, or you have aches, pain, or you start seeing colors around lights, or you find out that you are bumping into objects, you know, it's an emergency, you should come. Now, for those who don't have this, you should also come, because you may have a moderate glaucoma, not knowing that you already have this disease. And if you don't come on time, sorry, it is irreversible. At that time, we'll just tell you, sorry, how wish you came earlier. You know, don't fall victim of glaucoma. It is a disease you can defeat. It's a disease you can overcome. And like we say, don't be afraid of coming. Somebody said, if I come to hospital, they'll give me one disease, they'll put up a diagnosis. No. If it is there, it is there. If it's not there, it's not there. So please, our people, let's just do the needful. Let us fight this fight and overcome blindness. When we do the next survey of visual impairment and blindness in Nigeria, we may have the highest number of people with glaucoma, but let us not have the highest number of its consequences of visual impairment and blindness. Darlon.
Thank you.
Amen.
Thank you, Dr. Obinna. Thank you for your resourcefulness. Do have a great day, but take care of yourself.